Welcome to the online information session for the Francis Payne Bolton School of Nursing, hosted by Dr. Kimberly Edwards, Gayle Petty, and Carlier Meyers. I am Dean Michael Mason, and I will be taking your questions via email to be answered live on air. If you have a question, please send it to summerreghelp@case.edu with the subject line Info Session. If we don't answer your question live, we will follow up with you via email shortly. Now your hosts, Kimberly Edwards, Gayle Petty, and Carlier Meyers.
On behalf of my colleagues, Gayle Petty and Carlier Meyers and myself, Kimberly Edwards, we would like to welcome you to the Francis Payne Bolton School of Nursing webinar. The webinar this evening is titled Nursing at FPB, Preparing for Orientation and Beyond. This informative webinar is intended to prepare students for orientation, classes, and clinicals. During this webinar, we will focus on reviewing items that need to be completed prior to orientation. We will explore your schedule of classes and talk about what you need to do for registration. We will discuss what will happen at Prepare to Care on August 23rd and 24th, and we will give you an overview of our Student Services Department. Finally, you will be able to participate in a question and answer session by going to summerreghelp@case.edu. We will begin this webinar by reviewing 3 items that need to be completed prior to orientation. The first item on our list to review is the immunization documentation. Students need to show that they've received 2 doses of measles, mumps, and rubella, 1 booster of tetanus, diphtheria, and pertussis. They need to also show that they have a positive titer for varicella or the chicken pox. Also, they need to have a positive titer for hepatitis B, or they have to have documentation that they've received 3 doses of the hepatitis V vaccine. In addition, you will need to send documentation that you've received the 2-step PPD test or that you received the interferon gamma release assay lab value test. Now, the 2-step PPD test is a little bit more involved than what you will normally have as a student or as a professional nurse. This is a test that you will have done twice. So 2 PPD tests will be done, and you'll need to submit documentation of both of those. One additional requirement is now the flu vaccine. The hospitals are requiring that all students and faculty be vaccinated against the flu. Our flu season here peaks during the months of November through February, so sometime during the month of October, early October, we should start with our vaccinations. We'd want to be vaccinated for the flu. The deadline to submit your immunization requirements is July the 1st. So if you haven't submitted those as of yet, please get those in as soon as you can. If you have any questions, you can contact Tim Epic at University Health Services. His number is listed there on the bottom of the slide. It's 216-368-2745. You can also get on the website of University Health Services and you can view those requirements as well. The next item on our list is ordering uniforms. Students will need to order 2 white uniforms, 2 top uniforms, 2 bottom uniforms. They will come with the patches already sewn on them. The white uniforms will be worn in the hospital setting. You will also need to purchase 1 FPB blue polo shirt. This shirt is to be worn during your community clinicals. This will be used in the spring semester. You want to purchase a pair of white professional shoes. They should be made olive leather, no extra colors, no striping, no open toes, and no clogs are permitted. but please try to find a pair that is comfortable because you will be on your feet. You also want to purchase a watch with a second hand. Early into the semester, we're going to learn how to take vital signs, and it's very imperative that you have a watch with a second hand. There's one optional item, which would be the lab coat. Some students like to purchase the lab coat and wear it over their uniform. But again, that's optional. That would be if you'd want to do that. The order form is on the new student checklist, and orders need to be placed by July 15th in order so that you would have your uniform ready for clinicals. If you have any questions about sizing, costs, or anything related to uniforms, please contact Aaron Lay at robertscrubs.com. His contact number is 1-877-512-9090. Because we get many questions from the students about the uniform, we wanted to show you some examples. The FPB blue polo shirt there on the left, that's the shirt that you will wear in the community clinicals in the spring. It will come from the uniform company with the emblem already sewn on. The white shoes, again, need to be all leather, professional, and make sure that they are comfortable. The lab coat that's pictured there is a long lab coat. You can purchase the long style, or you can purchase one that is shorter, that meets at the hips. And don't forget, you need to have your watch with the second hand because we are going to need that in the clinical setting. Lastly, please make sure that you do submit your fingerprint waiver form. You want to do this and complete this as soon as possible. This is for students who are not 18 years of age. If you are under the age of 18, your parents are going to have to sign this form, and then you will need to submit it back to the school. The form is on the new student checklist. Okay, so now let's take a look at what your class schedule is going to look like, and we'll talk about what you need to do for registration. Your fall class schedule, you are going to take classes that add up to 17 credits. It's pretty much a full semester. You're considered full-time. And the first course that you're going to take is Nursing 110. It's Foundations of the Discipline. In this class, you will learn about the profession, about nursing as a discipline. You will learn about maybe the roles and the responsibilities in communication. This class meets on Fridays from 9 to 9:50, and it is a 1 credit hour class. I am going to pre-register you for this class. The next class on our list is Nursing 111. That's Foundations of the Practice 1. This is your bundled class. You have 3 classes for the price of 1. It's a very good value. You will have a class, you will have a lab, and you will have a clinical. The class runs from 3 to 4:15, or there's a second session that would run from 4:30 to 5:45. In addition, you will have a lab, a 1-hour lab, either on Tuesday or Thursday, and you will have 4 hours of clinical, either on Tuesday and Thursday. This is worth 3 credits, and I will also pre-register you for all 3 parts of this class. If you are playing a fall sport, you need to be registered for the 3 o'clock class. So if you are playing a fall sport, please send me an email and I will make sure that I get you into the 3 o'clock Nursing 111 class. Biology 114 is Principles of Biology. It meets every Monday, Wednesday, and Friday from 11:30 to 12:20. It is a 3 credit hour class. I'm going to go ahead and pre-register you for this class. Now, if you are going to receive AP credit and you get a score of 4 or more, you will not have to take this class in the fall. Okay. Biology 116 is Anatomy and Physiology 1. This class meets on Mondays and Wednesdays from 9 to 10:15. It's 3 credits, and I will pre-register you for this class as well. The next class is your SAGES course. It's your first seminar class. It is 4 credit hours, and you will be pre-registered from the SAGES department. Late in July or early August, you're going to receive information from the SAGES department. They're going to send you a list of classes that will fit your schedule, and what you're going to want to do is choose 4 of them and send them back. Send your list back to the SAGES department, and then the SAGES department will register you for your SAGES class. Nursing 277 is CPR and first aid. The CPR part of the class we are going to do on August 23rd or August 24th at our Prepare to Care session. I will pre-register you for both the CPR and the first aid. The first aid part of the class will be given for 1 hour on a Friday from 10 to 11 a.m. and we are going to meet August 31st and September 7th to complete the requirements for first aid. Wanted to let you know that once you have your CPR completed and your first aid, that qualifies for a half credit of physical education. And again, I will pre-register you for the Nursing 277. The last 2 courses on our list is where you're going to do the work. You must register in the Student Information System. So your general education requirement, you want to go to the SIS system and look up classes that fall under the arts and humanities or the social sciences. You want to look for classes that have 3 credit hours and try to identify some of the classes that meet your interests. The same for the physical education course. It will be your choice, and you must register for your class in SIS. So what you want to do is get on the computer, go to SIS, and for your GERs and your physical education, you want to put some of these classes in your shopping cart. During the week of July 12th through the 17th, you're going to be able to register for your classes. Now that we've seen our classes, I'd like to look at a template that we made for you. And we want to see when these classes are running during the week. If you look in the Friday column under Nursing 110, that class is posted there for you. So you know you're going to be in class every Friday from 9 to 9:50. First aid is also listed, but again, it's only 1 hour for 2 days, and then you would have your first aid class completed. If we look at the Nursing 111 class, go to the Monday column under Section 1. That class runs from 3 o'clock to 4:15. There is another section of that class that runs from 4:30 to 5:45. You will only attend one of those sections, either the 3 o'clock or the 4:30 class. In addition, we will pre-register you for a 1-hour lab. The Tuesday labs and the Thursday labs are listed there on the bottom of the slide. And then let's look at the slides, the columns under where it says clinical. Now clinical will run from 7 to 11 on Tuesday morning or Thursday morning, and then also the afternoon clinicals will run from 11:30 to 3:30. That would be on either of those days, Tuesday and Thursday. So when you look at this template, you will only be plotted on one of those clinical times. Biology 116 is listed there for you. It's on Monday and Wednesday from 9 to 10:15, and you know you're going to have Biology 114 from 11:30 to 12:20. So now that we know where our classes are, let's try to identify some places on the template where your GERs and your physical education or your SAGES classes may fit. So if you have a clinical on Tuesday afternoon, that would free up the time for Tuesday and Thursday morning to look and try to fit one of your classes into its place. What I will do is I will be sending out an email early next week, and I will send you a copy of this template so that you can start to prepare and look on SIS and see where some of your classes would fit. Okay, our Prepare to Care orientation is on August 23rd and 24th. It is a mandatory session, and during that session you will receive CPR from the American Heart Association. You will receive the basic life support CPR certification. We will do your background checks, and you will need to sign for them as well. You'll also need to bring a picture ID. If for some reason your uniforms don't fit, we will have a representative from the uniform company there, and you will be able to exchange your uniforms. Lastly, you will be able to print the completion of your immunizations, and then you're going to submit that to our BSN department. So now I'm going to turn it over to my colleague Carlier. She's going to give you an overview from the Student Services Department.
Good evening. I would like to take this moment to talk to you a little bit more about the Office of Student Services in the School of Nursing. We act as a home base for all undergraduate nursing students as well as all graduate nursing students. Anytime you have a particular question, you don't know where to go, please come to our office. It's an open door policy, and we're always there to help you in your time of need and when you have questions. We also have representation from the Financial Aid Office. We have a Director of Financial Aid that can answer general questions, as well as myself, the registrar, that can be there to answer questions for you about registration issues. If you need help and you don't know where to go or who to talk to again, please come to our office. It's an open door policy, and we'll help you in any way that we can. When you are on once you are on campus, please come and see us as well as for lockers. We do have lockers available for you to place your belongings during the day. You will need to share a locker with someone else, so it's a wonderful opportunity during Prepare to Care to make friends, find a locker mate, and come to our office and we can get you assigned a locker. We also have student mailboxes available for you, so as far as correspondence from your professors, information that the School of Nursing will send to you, there will be mailboxes available for you for those purposes. During your first week or any time thereafter, please come in and stop in our office, and we have a free gift for you. We are located on the ground floor of the School of Nursing, and come by and see us. I will now turn it over to Gayle Petty, who will tell you a little bit more about the highlights of our information session.
Thank you. I just wanted to reiterate some very important dates, and the reason why these dates are important and why we have these the criteria that we do with our immunizations and our background checks is because our students are in our clinical agencies in the community within the first couple weeks of school. And because you will be taking care of patients, you're held to the same standards as the agency employees are held to. So we need to provide this information, the documentation that you've had your immunizations, that you've had a background check, and that you are ready to be a safe practitioner in the agency when you are there by us providing that information to them. So please mark this on your calendar. The deadline that we'd like to present to you for your immunization documentation is July 1st. And I want to point out that the hepatitis B series sometimes takes several months. So please make sure that you start that process and you submit those results to us. By July 15th, we want to make sure that you have your uniforms ordered so that you are ready again for clinicals that first couple of weeks of school. Submit your fingerprint waiver form. The waiver form is only for students that start school when they are less than 18 years old. Parents need to say it's okay to have the students fingerprinted, and so that's why we need that waiver form. During Prepare to Care is when the fingerprinting process will take place, and if the student is not 18, we are not permitted to fingerprint you, and that will delay the process of the student being able to start clinicals. Please, as Dr. Edwards said, take the time to look on SIS at the courses that you might want to take for your general education requirements. You don't have a lot of choices this first semester. This is an area that you have some choice. You can either take a social science or an arts and humanities course, but spend some time seeing if that course fits with your schedule. And that is really what I wanted to summarize for you, is please mark down those dates and submit your information so that when we start clinicals, you'll be ready to go. The one last thing I do want to tell you is that we have a gift for each of you. We're very proud of our students, and as a little incentive to help you along the process of getting all your required information in, we will present you with a stethoscope. And this will be something that you'll be able to use in your clinical areas when you do vital signs or when you start listening to the heart and the lung sounds. Many times students, they don't get their information in, and then it delays the process of them being able to go to clinicals, and for sure it delays the process for them getting their stethoscope. And this is something that students really cherish. So we encourage you to follow the deadlines as we've outlined and get that information into us so that we can assure our agency partners that our students have cleared their process. Context.
All right, we are ready to start taking student questions, and we actually have gotten a few in already. For those of you who are watching this evening, please feel free to continue to send in those questions to summerreghelp@case.edu. Our first question that's coming in tonight, a student would like to know, what does it mean to be pre-registered for a course?
To be pre-registered for a course means that I, as their advisor, are going to assign them to those classes and do the registration process for them. They will not have to put those classes on SIS in their, I will place them there and they will be in those courses.
All right, we have another question. Could you please explain what SIS is?
SIS stands for Student Information System. It's the system that the university uses to help register all students across all disciplines. So you will get to know this system very well over the course of your time at CASE, and this is something that you will manage and be able to add your courses and make changes to your schedule, generally with your advisor's approval, but SIS stands for the Student Information System.
Thank you. We have another question. Is it possible for a nursing major to be part of a pre-health program, or in other words, to complete prerequisites for a health professional program such as medicine? And if so, how would the class schedule be?
That's a challenge. We don't recommend that students do that because For the required mandatory nursing courses, the first semester you're already at 17 credits. The biology courses that the nursing curriculum requires are different than the med student majors. So it's really a challenge to do that because of how little room you actually have in your curriculum, your schedule, to make choices.
Okay, another question. Do I choose the time of my clinical hours? And how do I know if I have the later or the earlier class?
At this point, you will not have the option to choose your clinical time. I will work with assigning those times for you, and I don't know. Sorry, can't hear. I will work on assigning those times for you. Those will be on your schedule in the SIS.
Okay, we have another question. This is for Carlier. At other nursing schools, people have to apply to get into the nursing program. Do I have to reapply to get into the nursing major?
One of the great things about being at Case Western Reserve University and being admitted to Case Western Reserve University is that you're admitted to the university as well as to the School of Nursing. They call it a single door admission. So it's a direct entry into our nursing program, into our classes. So you don't have to worry about taking any prerequisites. You are starting the nursing curriculum as well as the clinical experiences right away.
Another question. Can an AP score of 4 or 5 on an English exam get you credit for an arts and humanities general education course?
Yes, that can happen. We have, it's all outlined as far as how much credit you get for AP, and usually that is something that is an option.
We have a question for Kimberly. Will I have a nursing major and a advisor through my SAGES first seminar at the same time?
Yes, you will have both a SAGES advisor and myself. I will work with you specifically as the semester goes through, and I will help you even to plan your next semester of classes.
This this question is for Carlier. If I didn't indicate when I applied to the university that I wanted to be a nursing major, but now I would like to major in nursing, what should I do?
So at this point, one of the things that you will want to do is get direct in contact with the Office of Undergraduate Admission. If you have not confirmed your enrollment, if you've confirmed your enrollment, then you want to contact the Office of Undergraduate Studies. You would want to let them know that you have declared your major as nursing, because you will need to do all of the prepare to care steps, go through the checklists, go through the immunizations, order uniforms, and be on track with the other students that have already declared their major. So it's not too late. You still have time to make that choice, but you would want to do it right away so that you can make sure you are taking the adequate time to make it through the checklist on time and begin in the fall.
How many students are in the first year nursing class for fall 2012?
We have 74 students registered.
This question is for Gayle. Could you tell us more about where or in which hospital these clinicals take place?
Sure. All of our freshman students have their clinicals at university hospitals. That's an agency that's adjacent to the campus of Case Western Reserve. Students can easily walk to university hospitals. In their sophomore year, all of our students go to Cleveland Clinic. We have the bus route that goes up and down Euclid Avenue, and students can obtain a pass to ride the bus to Cleveland Clinic. And that is their first semester sophomore year. During the second semester sophomore year, the students have their med-surg clinicals at Cleveland Clinic main campus, And their psych mental health clinicals can be at a variety of different agencies in the Cleveland area.
Great. And we have some more questions on the topic of clinicals. Could you talk about when exactly the clinicals start and give some examples of what the nursing students will be doing at their clinicals?
Our nursing clinicals for Nursing 111 is actually going to start the second week of the semester. The first week, we're going to get you ready to go in the clinical setting. We're going to make sure all of our requirements have been met. What we do in clinical is skills that we have learned in the lab. For instance, we first have to go to the lab, and one of the first skills that we learn is how to make a bed. So once we learn how to make a bed, then in the clinical setting, we'd be able to do that skill. Maybe next we're going to learn how to bathe the patient. Once we do that in the lab, then we'll add doing both of those skills, maybe changing their bed and giving them a bath. We advance weekly by doing different skills. We'll do things such as learning vital signs, how to inserting Foley catheters, how to measure someone's intake and output. We'll learn how to communicate with the students. So there's a wide variety of skills that we're going to learn during Nursing 111.
Ready one? Great. We have another question. If I have AP credit for calculus, how does that fit into my nursing degree requirements?
Just in general about AP credit, all the AP credit is evaluated by the undergraduate studies department, and it actually tells what you get, what is transferable credit, and what it can be substituted for. So in general, I'm hesitant to say exactly what each different type of course is equivalent to, but that is the process. It's looked at and it is actually outlined, and you will know what it is, what the value it is with your curriculum here at Case.
Thank you. We have a question from the comments page. Can a student take the LPN licensure exam after their first year?
No. The LPN is a licensed practical nursing program which has a different curriculum outlined by the Ohio State Board of Nursing. What our students are able to do, though, I might add, is because our students start clinicals in their freshman year, which is not like other schools. Most schools do not start their clinicals sometimes until their junior year. But because our students have clinical experience in their freshman year, the summer following their freshman year, many times they're able to work in a hospital during that summer because they've had some experience in the clinical facility.
Okay, we have another question. How are the clinicals graded, or how do students get evaluated through their clinical practice?
Want to do that one?
Sure. It's a pass-fail. Basically, each of the clinical courses has certain criteria that is outlined, and there's a midterm evaluation that the student and the clinical faculty sit down and discuss what the performance has been, and then at the end of the clinical also, but it's not given a letter grade. Sometimes, however, as part of the clinical experience, there's a paper that has assigned points to it that is incorporated into the complete composite of the number of points for that class. That is all up to the particular faculty, but clinicals are pass-fail.
Great. We have another question about integrating a Spanish minor. Would it be possible for a nursing student to pursue a Spanish minor without being overwhelmed?
We have a lot of students that have graduated with minors, and a lot of it depends on how much AP credit they have. The curriculum in the freshman year and the sophomore year, it is pretty full, but if you have AP credit, say, that is the equivalent to one of your social sciences, that frees up students' time then to take a an additional class as far as Spanish or another arts and humanities, but it is possible to do that.
Great, thank you. We have another question that just came in. A student would like to know if you give practice exams for the NCLEX.
We have yes, we do. We have a process that we have integrated throughout our curriculum, and each of the courses actually have the integrated focused exam and focused exams with the class. At the end of the program during the last semester, we actually have 2 or 3 predictive tests that students are given, and there's a process that they go through with the Kaplan that actually there's a total of 7 different trainers that students are required to actually do before they take their NCLEX examination. So yes, we use Kaplan tests.
Great. We have another question. A few students would like to know your thoughts on trying to maintain a part-time job while being a full-time nursing student.
Some students do that, but we don't suggest that students do that. We prefer, it is possible and students do work. We do prefer that if you don't have to work, that you don't work, that you enjoy your college experience and you stay well rested and healthy, and we find sometimes that students, when they're doing too much, that's what starts happening to them. So they do work. We prefer you wait till the summer to work as opposed to while you're going to school, but students do that.
Great, thank you. A student from the comment page would like to know what research opportunities are available for nursing students.
Specifically, we have many researchers within our faculty. We are also very proud of the fact that we are encouraging students to move from a BSN to a PhD in nursing, and there have been several scholarships given to students for that when they decide to do that. What we like to do is to make available to students what faculty is doing what type of research, and encourage them to actually meet with that faculty person and negotiate what role that they would like to do with that. As far as formal research, our capstone class is our senior class that the students actually are engaged in a project, and they work with the community agency, and they actually then present their project that they do at our poster presentation here at Case Western Reserve, and they get experience presenting what their project results happen to be.
Thank you. Another question about the NCLEX. Would an out-of-state student take the NCLEX in Ohio or in their respective state?
It's really up to the student. And many times students graduate and they go back home and they take the NCLEX there, or where they're anticipating taking a job, they might move and take the NCLEX there. So that is really an individual decision.
Great. We have a few questions coming in with regard to varsity athletics. We could combine these questions. So, do clinicals ever interfere with sports? And also, do nursing students who participate in varsity athletics find it challenging to manage the demands of both?
We encourage our students to participate in the varsity athletics, and we also in our band. As Dr. Edwards was discussing, that we have an early section and a late section. Those students that are involved in varsity sports or the band, we actually allow students to have the earlier section of those courses so that they can participate. There have been times when during basketball season or volleyball season that there have been out-of-town meets that the students have desire to go to. That depends on the coach sometimes and the instructor, and academically how well the student's doing. Again, we encourage that, but we also want to make sure that the student still keeps their academics in high standing so that they participate, that it's important to them to know that they might have to make those choices sometimes.
Thank you. This question is for Kimberly. The student would like to know a little bit more about what actually they will be doing in lab.
Okay, in lab, well, let me back up just a second. First, for class, you will go to class and you will receive the didactic content or the lecture or theory content. After you receive that, you will go to your hour of lab and you will learn your hands-on skills type of event, such as, like I mentioned, learning how to make a bed, learning how to take a vital sign. So you're going to learn the how-to skill there in the lab. Once you learn that and you're comfortable, then you're going to go to the clinical setting and work with patients at University Hospital doing the skills that you've learned. Now keep in mind, we would never ask you to do something on a patient at the hospital unless you've been trained to do so. So say like on day one, I would never say, come on, let's go give this injection. That would not be appropriate, but we will get you there. That'll take some time, but we will get you to that point.
Thanks. Another question regarding AP credit. If I got a 4 or 5 on the AP biology test, should I notify the nursing department now so that I'm not pre-registered for Bio 114, or should we wait until after registration?
In the past, we've changed our registration process this year, and so when you registered for any of those, when you did your pre-registration, and that information was available to those of us that were involved in the registration process at the time. So I imagine that that is going to happen again, that before you're pre-registered for a class, we will know exactly what AP credit that you have been awarded, and that will, you will not have to take something or be registered for something that you've been given AP credit for. And if ever you have any questions about something, say for whatever reason you did get registered, by all means you would want to discuss that with Dr. Edwards so that that could be corrected. We want students to be in the level of courses which they are academically ready for. We don't want you to have to repeat information that you already feel comfortable with.
Great. This question is for Carlier. Where exactly on campus is the nursing school, and will all my classes be in the nursing school?
Well, the nursing school is located in an area of campus that's called the Health Complex, Health Science Complex. So we are where the School of Medicine is, as well as the School of Dentistry. So we're in a part that's right near University Hospitals, and we're sort of apart from the main campus, but we are still very much a part of the campus community. And most of your nursing classes will be in the School of Nursing, but not all. So you will still have an opportunity to have classes throughout the campus that would be perhaps for some of your biology courses, your SAGES courses, as well as any other elective courses that you will take for your classes. So you'll find us.
Great. We have a question about specialization. Is it possible for an undergraduate nursing student to specialize in any fields of interest?
In our junior year is when we do a lot of special nursing courses. We have pediatric nursing, we have OB nursing, obstetrics nursing with mothers and babies. We also last year started our new perioperative experience, which students are in the operating room. And we have a course called complex care where students are in the critical care area. That is the year that students are really exposed to the different specialty areas. In their senior year, students do 300 hours in a precepted experience. It's a transition from academic kinds of experiences to more of the real world, in which you'll be working with a staff nurse at one of our local agencies. And it is during that experience that students have some opportunities, if they really feel that they would like to be a pediatric nurse, then they choose pediatrics during that time. If they want to work in critical care, then they use that time to have their preceptive experience in critical care. So that is where we allow students to have some choice of what their preference might be and where they really are anticipating specializing.
Great. We have a nursing student who's interested in study abroad and would like to know if there are any study abroad opportunities available to nursing students.
The Case Western Reserve University has some study abroad opportunities in the summer, which is campus-wide, that students are allowed to experience that. We also have, as a part of our capstone experience, and our capstone experience is the practicum involved with community nursing. We have students that have studied abroad, and the countries where we have students will be going in the fall are Hong Kong, Wuhan, China. We also have students in Alaska. We have the students on the reservation in Arizona. And we're looking at Ireland now for another site.
Great. We have another question. A student who's interested in a double major with nursing and Spanish. Is it possible for students to double major in nursing and something else?
It would be very challenging because, as Gayle mentioned, the curriculum is pretty prescribed and scheduled. It's going to be very challenging to take additional credits to satisfy two majors. However, if you do come in with AP credit, that could help. You definitely would have to consider taking courses over the summer in order to do it. Again, because you've been admitted to the university, you are admitted to all of the majors and programs that we offer, and you would be able to take Spanish courses, but it may not be something you could do in 4 years in addition to nursing. So that would be something you'd want to keep in mind.
Great. Another question from the comments page. It was stated earlier that we get half credit for the physical education requirement from Nursing 277. So does that mean that we don't need to register for another physical education course in the first semester?
That's correct. In fact, we often suggest that you don't do that because you have a pretty heavy load with the credits that you have. And one of the reasons why we used to have the CPR used to be not really a full credit course, and we've actually combined it that way and do it prior to the start of the semester so that you will have your CPR, which is required for you to practice in the hospitals, and that you will also get credit for that. So the answer is that you won't have to sign up for another one. However, there are some students that like to sign up for it. They have a habit of exercising, and they like having that as an outlet. So we do not discourage students from signing up if they want to do an additional, more active type of phys ed course.
To add one comment to that, CPR is only valid for 2 years. So again, during your junior year, you will be taking the CPR class again. And then once you've completed the course, you will get an additional half credit hour semester for your physical education. So basically, you will get a full, complete semester credit of physical education.
Great. We have a few questions rolling in regarding clinicals. Students would like to know, is there anything that they can or should be doing at this point to prepare for clinicals in the fall?
Get your immunizations in. That's the best thing that you can do to make sure that we have that paperwork in place, because again, we have to assure the agencies that you have done that and that you're ready to go. So please, please, please make sure that you do that.
Great, thank you. Another question from the comments page. If I just want to major in nursing, do I need to take summer classes after the first year? For example, should I be taking a biology course at a local college or community college in my area?
No. but we have had some students, sadly, that might not have been successful at their biology course, and they've taken a biology course at a community college in the summer to make up that credit. And because we have actually, between the freshman and sophomore year, we actually repeat those nursing courses. Students have been able to take a biology course off campus and then come back into the program by repeating the nursing courses that they might, Nursing 122, if they weren't able to take that in the spring, they can take it in the summer and then rejoin their class in the fall.
Great, thank you. Another question about varsity sports. Does participation in a varsity sport count for physical education credit?
Yes.
And another question, is it possible to transfer a nursing license from state to state?
Yes. Each state board of nursing has a reciprocity process in place, and so depending on if you had your license in Ohio and you wanted to go to Georgia, you wanted to go to Florida, you would have to look on that state's board information page, and they will tell you how to do that. Every state's a little bit different.
Thank you. We have some more questions coming in regarding the Prepare to Care and CPR and first aid certification. So would it be possible for Kim, for you to go back over that again for the students?
Sure. During Prepare to Care, we are going to have breakout sessions on August 23rd and 24th, and during that time, you will become certified in CPR. Also, we will do your go over your immunizations with you to make sure that you meet all of those requirements. At Prepare to Care, we'll also have someone available there to help you with your uniforms. So Prepare to Care is actually a time when we're trying to meet all of our requirements, and then we're going to be ready to go into the clinical setting.
What is going to happen during that process is that all students will meet for the first half an hour, and then the class will be split in half, and half the class will be participating in the CPR lecture course and practicing CPR, while the other half of the class will be having their background check done, and will have the opportunity to exchange their uniforms if they need to do that and print off their immunization record. And then on Friday, the next day, the reverse process will take place. Those that did not have CPR will have CPR instruction and practice, and the rest of the class will then have their background check done and have the opportunity to exchange uniforms and to print out their immunization record.
Great, and we are coming near our time, but we have time for a few more questions. One question is, if I don't take a general education course my first semester, will that put me behind in my progress towards my nursing degree?
It can. We do encourage you that you take a general education requirement, because in the nursing curriculum, you have a lot of hours, over 1,600 hours are clinical time. And so it does take a lot of your time. And it ends up having, down the road, you could have scheduling difficulties with that. So you might have to go to summer school to make that, to have that opportunity. So we do encourage you to, if you don't have AP credit, that you should take general education requirement that first semester.
Great. We have another question regarding the orientation program. Do we have to be present for all times and days of orientation, or are there only certain times, days that we need to be there?
We encourage everybody to be there for the whole experience. This is something new this year at CWRU. Everyone is coming in a week early, and so there's lots of important information that will be shared during that time.
Great, and this will be our final question of the evening. Do nursing students engage in internships during the school year or in the summer? And if so, what type of internships do they take on? Students look on, it's up to the individual students. We have had students that have basically been employed. I think Mayo Clinic is one that has internship programs. Sometimes there's places in New York.
Students look and find those sites, and usually what they ask us to do is to write some kind of reference for them. So it's up to the individual student and how assertive they are for looking for those.
All right, and thank you all very much for joining us this evening. We'd like to thank our presenters again, Dr. Kimberly Edwards, Gayle Petty, and Carlier Meyers. We've placed on the screen for your information their contact, so please feel free to be in touch with them if you have any further questions that are specific to the nursing program. We would also like to take the opportunity to remind you of some upcoming online information sessions. Tomorrow evening at 7 p.m. we will feature 2 faculty members from the College of Arts and Sciences, Dr. Lee Thompson and Dr. Joe White, who will be presenting information on social sciences. Thursday will feature faculty members from the Case School of Engineering discussing biomedical, chemical, macromolecular science, and materials science and engineering. And on Friday, we will also feature more faculty from the College of Arts and Sciences, this time focusing on mathematics and natural sciences. We will continue our online information session schedule on Monday, June 25th, and running through Friday, June 29th. Please visit our online website, www.case.edu/newstudents/onlineinfosessions.html for a full list of the online information sessions as well as archives from tonight and all of our shows. Thanks again for joining us and have a great evening.